Good morning. Today's journal club's topic is the effect of forward and backward treadmill training on overground gait and dynamic balance in children with spastic diplegia. The article, which has been taken from issue 2, volume number 7, from Journal of Society of Indian Physiotherapists, from the publication of January to June 2024. I'm Joel Tejpal, Assistant Professor at Parul Institute of Physiotherapy. The title of the article is The Effect of Forward and Backward Treadmill Training on Overground Gait and Dynamic Balance in Children with Spastic Diplegia. The authors are Meenal Jain, Sampada S. Shahangir and Raju Parasar. The article, which has been taken in the Journal of Society of Indian Physiotherapists, which has been revised on 15th November and published on 11th March. The abstract. As dynamic balance and the ability to walk freely are crucial for the functional independence and social participation in children with spastic diplegia. Backward gait training on a treadmill involves dynamic balance and the ability to walk freely are crucial for functional independence and social participation in children with spastic diplegia. Backward gait training on a treadmill involves rhythmic motion similar to the forward walking, but it is more challenging for the stability system. It is suggested that backward gait training on a treadmill may result greater improvements in overground balance and gait compared to the forward treadmill training. So, the objectives of the study was designed to establish intra-tester reliability of the pedograph method and to compare the effects of backward treadmill gait training to forward treadmill gait training. The materials and method: 20 spastic diplegic children aged 7 to 17 years were randomly assigned to either a forward or backward gait training group. Spastic gait parameters has taken with the pedograph method, and dynamic balance will be taken with the time up and go test. Assessment were conducted pre and post 16 sessions of the intervention. Intra-class correlation were calculated over these three trials measured by the primary investigator to ensure the reliability. The result, intra-tester reliability, was found to be very good for the step length, stride length, degree of toe out and step width. Step length, cadence and time up and go test demonstrated significant changes regardless of the training method. The conclusion, which mentioned in the abstract, is the pedograph footprint method for measuring spatial parameters were found to be reliable and easy to use in a clinical settings. Forward and backward treadmill training, when combined with conventional physiotherapy, were equally effective in improving overground gait and dynamic balance in spastic diplegic cerebral palsy children. The keywords mentioned over there are backward gait training, cerebral palsy, pedograph, spastic diplegia, and treadmill training. So, starting with the introduction. As spastic diplegia is a common type of cerebral palsy which is characterized by significant motor impairments in the lower limb. The management of spastic diplegia primarily aims to improve dynamic balance and gait. Recent research indicates that the mechanical treadmills can improve walking in the children with clinical cerebral palsy by providing repetitive, rhythmic, and intensive gait cycle training. So for that, backward walking on a treadmill, that is retro walking, has been introduced as an intervention to enhance the balance and gait. Backward walking can increases the reliance on vestibular as well as on proprioceptive systems due to the lack of frontal visual stimuli. And backward walking is also associated with the greater leg muscle activity compared to the forward walking, which leads to increased muscle strength and improved balance in children with hemiparetic cerebral palsy. The transfer of backward gait training effects has not been thoroughly studied. In recent times, gait assessment increasingly use electronic high-tech equipment, but it is not widely available. Historically, low-tech methods like manual padograph or footprint methods were commonly used for research and clinical purposes. The padograph method developed by Boeing is easy to apply, less time consuming, and allows for measurements to be taken with the shoes on. That is suitable for the use in clinical or even the field settings. Thus, the objective of the study are to establish the reliability of the padograph and to compare the training effects. Material and methods were used. Participant 20 children spastic diplegia, that is aged between 7 to 17 years, were recruited as volunteers. Inclusion criteria were the spasticity in the lower limb was less than grade 2 on the modified Ashworth scale. GMFCS score needs to be ranged from level 1 to 3. Able to walk independently with or without any assistive device and capable of understanding and following instructions. Ethical procedures. The study received ethical approval and parental consent and participant assent were obtained. Participants were randomly assigned to both the groups. Exclusion criteria that if patient is having visual or perceptual deficits, they can interfere with their participation were excluded. Recent muscular injury within the past 2 weeks were excluded. Recent surgical or Botox procedure within the last 6 months. So, during week 1, gait parameters were measured using the padograph. Participant walked with assistive device on an 8-meter walkway. A long strip of water-absorbing material, that is dynaplast, was placed on the middle of each shoe from toe to heel, and paint was applied with a brush to saturate the dynaplast on both the shoes. Here we can see in the photographs as well, we had just mentioned over here, so we can take the footprints over there. Participants were seated at one end of the walkway. They were asked to stand and walk normally at their self-selected speed. Participants were instructed to look straight ahead for the entire length of the walkway. Assessment method: an average of 3 successive mid-gait footprints were analyzed. The following gait parameters were assessed, that is step length, stride length, step width and toe out. The cadence measured from a video recording and dynamic balance were measured with a time up and co-test. Testing began with a demonstration of the procedures to familiarize the children with the test. Testing phase, in that pre-testing and post-testing. Pre-testing conducted on the 3 alternative days over a week, that is pre-test 1, 2 and 3rd before the intervention, and post-testing conducted on 3 alternative days following the intervention, that is post-test for 2nd and 3rd. Intervention: participants received either forward or backward gait training on a treadmill for a total of 16 sessions. Both groups concurrently received conventional physiotherapy. Pre and post-test results were analyzed to evaluate the effects of forward and backward gait training on balance and gait. The intervention included both conventional therapy and treadmill training. Warm-up session is for 5 minutes of walking over the ground. 5 repetition of shoulder flexion, elbow flexion, wrist flexion, active range of motion has been done. Session is containing stretching exercises, strengthening exercise, functional training and balance training. Both the group received treadmill training following the warm-up and therapy session. Children walked with a comfortable speed for 15 minutes on a flat treadmill, and children rated their perceived exertion using box 10 RP scale. Safety and adjustment, that is, children were asked to hold on to the treadmill bars. Treadmill speed was gradually increased by 0.1 to 0.2 meter per hour every 2 to 3 days based on the child's comfort level, aiming to challenge the child without causing major fatigue. At a 95% confidence interval were used to establish the reliability of the pedograph method for measuring the gait parameters. Now, statistical analysis. So, repeated measures of ANOVA, that is used to analyze the dependent variables, with one between group factor, that is forward versus backward training, and one within group factor, that is pre-test versus post-test. Mann-Whitney test will be used to apply to analyze the degree of toe out due to the high variance and significance level. All comparisons were considered significant at a P level, that is less than 0.05. Now the results are: for forward training group, there were 6 males and 4 females, and for backward training group, there were 8 males and 2 females. The first 3 valid trials were used to calculate the intra-test reliability of the pedograph method. ICC for step length, stride length, degree of toe out, and step width were found to be 0.95, 0.98, and 0.87 respectively. These are the comparison of baseline characteristics of age, height, and weight of parameters in forward and backward training groups. That is age, height, and weight, which is happening with the forward gait training and for backward gait training. The variables are for step length, stride length, step width, toe out, and cadence, and time up and go test. Between the two experimental groups from pre to post intervention in the following measures, that is stride length, step width, and toe out, the significant main effects in the following measure, that is left step length is 5.95, that is significant, cadence is increase, that is 26.89, and time up and go test, that is 180, and then 10.53. In addition, there was a significant interaction following the Turkey's post-hoc analysis that suggested a significant reduction in right step length in the forward gait training group intervention. Discussion. This study was designed to establish the reliability of the pedograph method and to compare the effects of backward and forward gait treadmill training over a 6-week intervention period on gait and balance parameters in a spastic diplegic children and adolescents. Pedograph method using Dynaplast preferred over the powder method, that is Wilkinson and Menz, due to difficulties with the powder in children with cerebral palsy. Method can be used in less rigid clinical settings and demonstrated good intra-tester reliability for measuring of step length, stride length, step width, step and degree of toe. Both interventions lead to improvements in a step length, cadence, and balance. Changes in step length result from enhanced muscle strength, coordination, weight bearing in the stance phase, and joint mobility. Decreased step lengths and increase in cadence and gait speed. Larger step length will be increasing the risk of falls due to the greater instability and higher chances of slips. Abdel and Ezeman Basinti found significant improvement in the step length following the treadmill training, whether forward or backward. Cadence increases after both forward and backward treadmill training. This improvement is attributed to enhanced joint mobility, reduced spasticity, and improved muscle strength in the quadriceps and hamstrings. The increase in the cadence during backward gait training due to improved dynamic postural stability. There is significant improvement in a dynamic balance as both groups had reduced time in performing the time up and go test in post intervention. Kim et al. Suggested that the improvement in balance is due to efficient sensory motor interaction involving muscle and joint biomechanics. Several spatial gait parameters, including stride length, toe out, and step width, did not achieve statistical significance due to high variability within and between groups at the start of the intervention. Participants in the forward gait training group initially had longer stride lengths and larger base of support compared to those in a backward training group. Previously, Amir et al. Also found no significant improvement in the gait parameters, but in this study, use of handrails while walking on a treadmill that reduces the challenge of backward gait training by decreasing the spinal and cortical activation. So, majority of the studies use advanced 3D system as they are not commonly available in many clinical settings. The 2D footprint or padograph method used in this study was clinically feasible and technically reliable. Post-intervention, participants reported increased confidence in walking, fewer falls, easier stair negotiation, and the ability to walk with the alternate steps. It is suggested that these qualitative measures be included in future studies to provide a motor comprehensive assessment of intervention effects. Limitation of the study, that is a small sample size. The study's small sample size limits the internal validity and generalizability of the findings. High variability among children with spastic diplegia further affects the validity and generalizability. The use of convenience sampling may have introduced inadvertent selection bias. Participants were randomly allocated to each group. Good reliability of the measures used help in improves the study's validity, and standardization of the experimental protocol and procedures also helped mitigate the validity threats. The future studies, additional studies are needed to determine the relative efficacy of forward and backward gait training compared to the traditional protocols. Larger sample can be involved, longer intervention can be extended, and future research should explore the effect of variables such as variable speed, inclination angles, and training progression. Future studies should include a qualitative analysis of patient and caregiver reports, clinical observation, a record of the number of falls, and confidence level, etc. Both forward and backward gait training on a treadmill are effective, safe, efficient for improving dynamic balance, step length, and cadence, especially for the school children with spastic diplegia. The study's results are highly relevant for the therapeutic rehabilitation. The findings can guide the development of more efficient rehabilitation treatment protocol for managing the spastic diplegia. Footprint or padograph method for measuring spatial gait parameters was found to be easy to use and produce reliable and valid data. It is recommended that this measurement method be included in the clinical assessment of the children with disabilities, including low and middle income countries. Financial support and sponsorship is nil. Conflict of interest, there is no conflict of interest are there. Acknowledgement has been given to the authors, that is supervisor and co-supervisor, Sampada ma'am and Raju sir. Uh, the author has thanked to other faculty members of the HIIPT and the family as well. According to the Petro scale, the scores is 8, which is considered as a high quality article because it has included all the criteria into that. Thank you.